I have a question for you. A 31-year-old female presents with progressive muscle weakness and double vision that worsens toward the end of the day. On exam, she has bilateral ptosis and a decremental response on repetitive nerve stimulation. This points directly to myasthenia gravis, but down at the molecular level, which specific receptor is being destroyed? You will learn the answer to this question after watching this video. Today, we will be talking about nicotinic receptors of the autonomic nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. First, let me tell you about our roadmap. This is a acetylcholine receptor map. Acetylcholine has two receptors, one nicotinic and two muscarinic. Similarly, nicotinic receptors also have two subtypes, one neuronal and two muscular. Today, we will focus on the nicotinic receptors of acetylcholine. Let's talk about the neuronal subtype of the nicotinic receptor for acetylcholine. Are you wondering how to remember the neuronal nicotinic receptor? It's very simple. Neuronal nicotinic receptors are located in the autonomic ganglia and mediate synaptic transmission. So, let's set up the equation then. Neuronal nicotinic equals node, neuron, network. Additionally, neuronal nicotinic receptors are located in the adrenal medulla. As you know, the adrenal gland is located on top of the kidney. When these neuronal type receptors are stimulated by acetylcholine, it triggers the release of adrenaline from the adrenal medulla. Then we will continue with muscular nicotinic receptor. Similarly, this is also very easy to remember. Acetylcholine stimulates muscle-type nicotinic receptors, which leads to the contraction of voluntary muscles. Let's set up the equation then. Muscular nicotinic equals muscle. Let's remember our question. Female patient, progressive muscle weakness that worsens toward the end of the day, bilateral ptosis, diagnosis is myasthenia gravis. But down at the molecular level, which specific receptor is being destroyed? Yes, the underlying pathology of myasthenia gravis involves autoantibodies directed against the postsynaptic muscle-type nicotinic receptors. This leads to receptor degradation and a diminished end plate potential. And that brings us to the end of today's topic. Now that you have mastered the core functions of nicotinic receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. If myasthenia gravis destroys nicotinic receptors, what class of drugs do we use to increase acetylcholine levels at the synapse and improve symptoms? I will be waiting for your answers in the comments. See you later.